During my medical training, I was overall interested in medicine, but we had a very good teacher in preventive and social medicine, and that attracted me to get into public health. Even though my father was a surgeon and I could have naturally become a surgeon following his footsteps, but then because of this teacher, and then we went in our internship in various slums and did some work there, so I was motivated. Then the chance came that I was admitted, I applied and I was admitted in Hopkins, which was one of the top schools. So I decided to leave the general surgery training which I was doing, and then went to Hopkins to do my MPH. And after that, I completely shifted to public health. I have largely worked on 2, 3 areas. One started work on family planning, where you clearly see that it is much beyond just contraception. The social organization, the gender issues, the poverty, the remoteness, everything affects women and men's choice and availability of family planning. So that was my starting of understanding of how social determinants of position, gender, remoteness, poverty, etc. affect the need for children, the demand for children, and use of contraception. Beyond that, then I started working on reproductive health and as well as later on in maternal health, which also showed me how access to care becomes very important rather than the medical technology. Of course, technology of obstetrics is important, but women die in India largely because they don't have access to care. And partly it is because of their poverty or remoteness or the non-functioning of the health system, which may lead to non-availability of care, and sometimes even policy issues. For example, blood being not available is in rural areas is because of the policy restrictions on trying to make blood safe. The policies have been such that they have made blood inaccessible. And that is how various factors within the society as well as the health system constrains access to care. My sense is strength is it makes really public health much wider than what is construed as preventive and social medicine in medical colleges or community medicine, which is more clinically oriented or only preventive oriented. If you take into account the social factors, they get into all aspects of the society, including things like housing, employment, social position, income, poverty, access to care, health system organization, health economics. So in some sense it really reflects the wider ramifications which affect health, and in that sense it makes public health a much wider multidisciplinary subject. The limitation is sometimes people sort of feel that it is too wide and it is out of the purview of public health people. The way the public health departments are structured, which is largely filled with doctors and medical hierarchy, they may think that, for example, preventing road accidents is completely out of their hand. They may organize emergency medical care, they may organize hospitals to save patients with trauma, but they cannot think how to prevent trauma, which in some sense with the medical mindset is true. But if you take a wider sort of aspects, how to improve roads, how to improve vehicles, how to improve compliance with seat belts and helmets, all of that becomes public health. But given its vastness, sometimes the typical medical public health people may not be able or willing to enter into these various fields. I'm most familiar with the maternal health field, so I'll take one example from that. one of the understandings in maternal health was that you need emergency care, access to emergency care. Now, what it originally was thought was that government doctors should provide emergency care, but this was not possible, especially in Gujarat, because government doctors are not willing to stay, especially obstetricians in rural areas. So, a lot of posts are vacant at CHC level. Given this thinking, government with our help when I was at IIM developed a policy and program called Chiranjeevi program, where they enrolled private practitioners who were obstetricians or general surgeons available in rural areas to provide care to the poor women and tribal women. And this improved the access to care substantially to these groups. Similarly, another public-private partnership developed with EMRI to provide ambulance care, which is also an important part of emergency care access, and that is how improving transportation as well as improving availability of access to private sector care led to much improved maternal care, especially among the poor, at very little cost and very little managerial effort in the health department. My sense is we have neglected water and sanitation. In some sense, in most of the public health schools, the fields of microbiology, biochemistry, testing of water, sanitation, improving access to water, etc., needs to be really rebuilt in Indian context. And in that context, Mr. Modi, the Prime Minister's call of Swachh Bharat or Clean India is very much on spot in improving health through sanitation and related efforts. I think social determinants of health provides a very wide canvas for young researchers and public health practitioners to enter with various different backgrounds. For example, even a civil engineer or a lawyer or a chemist can enter public health using their own background and using that as a platform to build on. For example, better housing or better water supply or improved sewerage or improved social and psychological support, somebody with psychology background can provide. Better counseling, which has been so much talked about in HIV related fields and many other sensitive fields. So this approach sort of in some sense demedicalizes public health to much wider backgrounds of students, and they can then have the advantage even over the medical graduates who may have specialized knowledge in one field, but it may not be adequate for the fields where other social determinants are very important. Somebody like a background with mathematics and statistics may be very good in epidemiology, mathematical and social research, statistical research, etc. Somebody with demography background may be very useful in demographic and population related research, much better than a doctor or a doctor and a public health person. So that is, I think, I see as a main advantage of having social determinants as underpinning for public health.